go. Madeline. So we're just going to go ahead and start this visit if that's okay with you.
Okay.
Yeah. How's everything been? How's your leg?
My leg's good.
Yes. Okay. I think it's probably a new experience. It allows them to have the interaction that they want to have with their physician, minus the actual physical contact, but us to be able to interact with each other with their physician from the comfort of their own home. And then with the bed sore on your other ankle, we asked you to put some compression on it when you were sleeping. Has that helped?
Oh, it helped a little bit, but it is still very sore.
Okay.
No, it's just really sore yet.
Bed sores take a while to heal, so sometimes that you have to really get pressure off that spot for an extended period of time before it's going to resolve itself.
Did you want to visualize those wounds at all?
Just so I can take a look and make sure it looks okay?
Absolutely. There's no drainage on the one that she had the Band-Aid over. This is the one on the left that you were talking about.
That's the one that she had covered up. That looks like it's healing much better. That looks great. A lot of people in Tillamook have trouble with transportation. We have an older population, some of which who do not drive and are dependent on public transportation and their family members, and a lot of them would probably prefer to have their visit in their home if it's at all possible.
She did have a fall on Saturday. She was walking into the greenhouse and tripped over the hose.
Okay.
And so she has a little skin tear on her right elbow. So when we're done with this, I can show you that.
I guess what I felt was nice about having Kylie there was that she could ascertain a lot of the data that I really needed to feel comfortable that Madeline was getting the care that she needed, even though we were in a virtual visit and I wasn't in the same room with her.
The bases are definitely diminished, and there's a little bit of wheezing.
Okay.
Bilaterally on the lower lungs, but at the top, it sounds pretty clear.
Great, that's very typical for her. Okay, that's wonderful. Thank you. It's going to be different, you know. I think that we're probably going to be requiring them to do a little more hands-on with the patient, maybe going out to their home and being able to do things that we may require during the visit, such as vitals, assessments, letting us know if a particular wound looks like it is infected or not. They're going to be working with physicians directly, which is kind of nice. I mean, we do work with them directly now, but I mean a face-to-face where they're dealing with the patient at the same time the physician's dealing with the patient. And I think it's going to introduce a lot of new arenas, a lot of new things to what their profession is and what they're doing now. I've refilled those 2 medications for you, and you just let me know if there's any changes, if you have any recurrence. If either of those wounds look like they're getting infected, get more swollen, get red, have drainage, are more tender, you let me know, because we can always put you on another course of antibiotics if we need to, okay?
Yeah.
Okay. I believe that this technology is here to stay. It's going to continue to be here. Patients are now going to see how useful it is for them and how beneficial it is, and so are physicians, and we're going to continue to use it from this point forward. So I think it's probably going to become a part of the norm when it comes down to primary care.